Hello everyone. On this episode, we'll talk about protein in your veggies. We'll talk about band versus sleeve, what to decide and what to have done. And we'll talk about the gurgling sensation or that noise in your sleeve and much more.
Jump!
Is it normal to have gurgling in the throat and ears 9 months out from sleeve?
Okay, so the gurgling sensation or that noise or that feeling that you hear, feel, notice, it's frequent and it is a sign that the sleeve is swollen. You may want to jump into your antacids or do a round of antacids for 10, 15 days, 21 days, and that gurgling sensation will go away. It's very important you redo these antacids every once in a while when you have that gurgling sensation or you hear the gurgling, because it's just the noise that is produced when the liquid or food goes down, and it's so tight that it'll gurgle. It's sort of like pouring a lot of water into a funnel. You'll hear that gurgling noise. So it's normal. Expect that even though the endoscopy comes out normal, that means everything is fine. It's just that the swollen tissue of the sleeve is present. All right. So make sure you take your antacids and take care of that sleeve.
If all your levels are good, do you still need to take vitamin daily?
So even though your vitamin levels are good, you still do need your vitamins. I recommend a multivitamin every day. Make sure all your levels are good. I take multivitamins. I don't have a sleeve, but it's very important that you supplement your vitamins and minerals and make sure everything is good. Now, maybe down the road, if taking a vitamin is a hassle, you get tired of it, you can switch brands, you can switch the form, you can do sublingual, B12, you can do even shots if you don't like taking vitamins every once in a while. You can switch from the solid pills to the gummies. Work yourself around this and take your multivitamins, take your vitamins, your supplements, they're very important.
What to buy before and after surgery to be prepared.
So what to buy before surgery? That is a question that you'll have to touch base with your surgeon, with your surgeon's team, that he or she will let you know what they prefer for you to buy. For us, we give our patients a shopping list that we recommend to have before coming down for surgery. It includes the first week of liquids, the clear liquids, the recommendations we ask you to buy, also the things what to bring down. And even though we ask you to pack lightly, we do recommend that you have this shopping list and you go over it. Make sure you have that prior to coming down here. So I would touch base with your surgeon prior to coming, or your local surgeon, and he or she will give you this shopping list. We have a PDF already set up what to have before coming for surgery.
How long after surgery can one go to the chiropractor to get an adjustment?
So after surgery, you can go to a chiropractor. I would recommend at least 15 days out. It doesn't mean that if you get an adjustment with a chiropractor, you'll move something inside or burst your sleeve or anything like that. It won't happen. But I would recommend, because of your decisions, laying on your tummy or something, I would just recommend 10-15 days out until you feel comfortable, and then you can go to a chiropractor.
What are your main protein sources as a vegan, and would you recommend veganism to your patients?
All right, so the main source of vegetable protein. All right, it's very important for you to understand that protein just doesn't only come from meat. All right, so I'm a vegan. I've been a vegan now for about 5 to 6 months, and my main source of protein, you can get them from nuts, you can get them from kale, you can get them from mushrooms. All these very good superfoods are very important for you to get your protein. People get overwhelmed with the protein thing after they have weight loss surgery. People, take it easy. It's not as hard as you may think, all right? Eating your veggies is a good source of protein. Not as good, of course, as a piece of salmon or your meat, of course, but you can make yourself through it easily being a vegan, all right? So look at, we'll take a look at the superfoods in a few minutes.
What procedure would you recommend? Sleeve or band?
That is a good question, and I could go an hour just talking about this. I would recommend the sleeve or the band anytime. The sleeve is way better procedure than the band. I wouldn't even look at the band at all, not anymore. We brought down the band as a procedure we would perform back in probably about 4 or 5 years ago. We don't do any more bands. We do take bands out. We do convert those bands into sleeves, but I wouldn't recommend a band nowadays. Sleeve, way better, no foreign body inside, adjustments, you don't need any adjustments, any maintenance. Entrance of the stomach stays the same, the exit of the stomach stays the same. Hunger goes away with the sleeve, not with the band. So any day, sleeve over the band, all right?
Is there one superfood that you would recommend I put into my diet?
All right, talking about superfoods. There are some superfoods that are very important in a vegan's diet, but of course you can make use of it. Number one, you can use kale, very important, very nutrient. Kale, quinoa is very good. Chia seeds. These types of superfoods are very recommended. They contain a lot of nutrients per cup or per serving that you can get the most out of it. I use them a lot. They're very good, and once you get the hang of it and cooking them, you'll love them.
How many calories per day should a gastric patient consume for better health and losing weight efficiency?
Calories recommended for gastric sleeve patients. Normally, after surgery right away, you will have the maximum point of restriction patients are doing right after surgery, 600 to 800 calories per day. After a few months, I'm talking about 3 to 6 months, you'll probably be doing close to 800, maybe 900 calories per month. And once you're about a year out, you can be doing between 1,000, 1,200, or 1,500 calories per day. That varies from patient to patient because of the size of the stomach, because of the size of a sleeve, the way it was done, because of the size of the bougie, etc. But keep that in mind, 600 to 800 calories. Then it jumps between 800 to 1,000, after a year about between 1,000 and 1,500. So don't forget to use your hashtag AskDrA. We'll be looking at YouTube, Facebook, Twitter, Instagram. These social media networks, we will be on the lookout for the hashtag AskDrA. If you don't use the hashtag, there's no way we can actually pick it up and use it for future shows, all right? So I have a question for you. You can write it down on the comments. What is your favorite social media network? What do you use most frequently? And we can attack that directly. Thank you so much. Thank you for watching. We'll see you next time on the AskDrA show.